Welcome, everyone. My name's Hannah Austin, and I am the CEO and founder of She Shatters. I am an honorary member of the Workplace Wellness Collective, and I'm going to be your moderator today. I want to welcome you to part 2 of our Wellness Learning Through the Lens of DEIB session. Today's topic is Recipe for Success in Employer and Employee Wellness Savings, part 2 of 2. This is a follow-up to part 1 of our series, where we will be discussing tips, tricks, and strategies to leverage data to your advantage to create a healthier organization and workplace. This event is being live streamed to LinkedIn and YouTube, so check us out there at the chat below. We will be taking questions at the end when we do a Q&A, so if you have any thoughts, questions, please react in the chat, leave your comments, emojis, and etc. And Matt will be bringing up those questions on the screen at the end of the session, and hopefully some of the answers as well. In a moment, I will be bringing up our incredibly talented speaker, Debbie Bellinger, in a minute. But first, before we do that, I want to share a little bit about the Workplace Wellness Summit Club. And we're going to talk a little bit about what it is and why it's so important that you join this incredible community. So back in the fall of 2021, the founder, Sumana Jetty, started a workplace wellness group on Clubhouse. From there, she met some incredible workplace wellness leaders, and together they decided to host a mini micro summit. It was so successful that they decided to host a 2-day wellness summit. And then based on community feedback, now we're starting to expand with webinars, charts, Q&A sessions. And if you're interested in learning any more about these events, please check us out on our Workplace Wellness Collective at www.theworkplacewellnesscollective.com, and we'll also be dropping that in the chat later on. There you're going to find some excellent resources and support for you and your teams to get excited about the rest of the year ahead and then 2023. So let's get back to the main event. I want to bring up Debbie Bellinger. Debbie is an awesome solo entrepreneur of Body by Definition, which provides advisory services to individuals and organizations who wish to add wellness programming and offerings to their menu of services. She is an incredible woman. She's building on-demand educational library for fit pros. I was just telling her how fit she is, and small to medium-sized clubs. Her first masterclass was launched in February titled Fit Pros and How to Break into Corporate Wellness. And it was accredited by the Master National Board of Health and Wellness Coaching. Debbie won several awards. She was the 2017 IDEA World Program Director of the Year and the 2014 Medical Fitness Association Program Director of the Year. And she specializes in employee wellness for healthcare systems. Welcome, Debbie. I'm so excited for you to join us today and to join me. We have so much fun together. And thank you for being here to lead us in part 2 of this incredible discussion.
Thanks, Hannah. What an amazing introduction. Hannah, thanks for that. And I do want to say a big thank you to Sumana, who connected with me, and Matt, who's helping out here. We couldn't do it without Matt. Meredith, who's been in the background helping too. And today it's Hannah and I. So without further ado, thank you so much for coming to part 2. If you missed part 1, I know the recording is available. And basically what we did was we had a really lively, interactive conversation about workplace well-being and why now. And clearly, and Hannah and I were just discussing this, in our world, things are not slowing down, right? So the challenges for employers, organizations at large, and us as employees, however we're working, whether we're in solopreneurship or small company or large company, the challenges remain. And so they're not going away anytime soon. Hannah and I were just speaking to this. And so today's focus will be a follow-up to part 1, which will allow for us to speak to some of the recipes for success. So in part 1, there were some really amazing questions around what should we be doing right now? Where do we start? A question around the importance of data, which led to a conversation of potential data sets that could leverage the conversation of the importance of workplace well-being in our universe, right? And I am really passionate about delivering the well-being message to wherever there's people. So that could be companies, churches, communities, apartment complexes. There's just not enough of us spreading the message of well-being in the world right now. So empowering all of us to keep these conversations going, keeping them interactive, it's very, very important. So we're just going to dive in. And as Hannah mentioned, we'll keep the questions till the end, but I'm going to ask some questions of you and you're going to type the answers in the chat box. All right. And then when we get through the content, we'll all come back and have some more lively conversation. All right. So recipe for success. Here's what we're going to learn today. So the learning objectives of today, I have 3 goals for us. Thank you, Matt. So what are the pain points in corporate America for employees in the well-being space and employers? What is it that we're all struggling with to be healthier day over day, focusing on the lens of corporate wellness? And then I'd like to have a little bit of a conversation, get us thinking about data sets that we can use to measure how we're affecting change to healthier individuals and healthier organizations. And let me just say, this is not a one-size-fits-all approach. A dashboard of success to measure individual health, organizational health, has to be customized for the individual and or the organization, right? And I know I'm preaching to the choir, but just an iteration of, you have to kind of select which KPIs, which metrics, which data points you want to hang your hat on, right, for the long game. So that is a customized solution. And then I want to share with you 2 actual examples from my work that in full confidence I can tell you work based on my experience, how to leverage data, spend, and to make things happen in a world where maybe there's no money to be spent on well-being. We're going to talk about some strategy at that point. All right, so those are the 3 takeaways for today. So let's start with, if you would, what do you believe to be the employee pain points? As an employee of a company, what are the challenges to be well every day at work? As an individual, what might those be? Feel free to type in the chat. And so some things come to mind in this space, right? So I see burnout. That was the number 1 that I had. Thank you for that, Farah. That's really good. Oh, Farah's the one that had the woo-woo t-shirts. Welcome back. So good. All right. So burnout. Yes. In looking toxic culture. Thank you, Samana. Really, really good. So in looking at the American data and Canadian data, I just presented for CanFit Pro Fitness Convention this past weekend. So I had my nose in some Canadian stats, and I always have my nose in the American statistics. But it's looking like the most recent that I've seen, we've got toxic culture, benefits, difficulty transitioning from work from home back to the office. Yes, all really, really good. Particularly in the burnout space, 1 in 5 Americans has been diagnosed with burnout, and it now has an ICD-10 code attached. And there are implications around that. So formal disease process, and Farah, you're making me smile. And in Canada, I just read most recently, it's 1 in 4. So as Hannah and I were just discussing, this is not going away anytime soon. Also add to your list, in addition to toxic culture and customizing benefits to the needs of the employees, that sits on both sides, right? Both employee and employer, is obesity. With obesity on the rise, there's a lot of challenges if you present to work as an obese individual and you're not feeling your best every day, right? And you may not know why you're not feeling like you can focus, or why there's so much neck pain or exhaustion. And so with the different disease states comes different health challenges, which directly correlates to employee productivity and employee feeling fully engaged at work, which then tracks downstream to the bottom line, the economic conversation of productivity and the success of the company, right? So these are great employee pain points. And as Sumana said, yes, transitioning back to work, it's not as simple as going from your home office back to your work office when you've been gone for 2.5 years, right? So if you think of the difference between introverts, extroverts, a lot of folks are really happy working at home alone. And, that suits them better than being in an office with a lot of folks and folks dropping by a desk and starting conversations. It diminishes focus. So all of these things are relevant to current pain points for employees in the current space that we're in with the Great Resignation or the Great Reset or the Great Reprioritization, whatever we're calling it. Working from home, transitioning in the back to work, those two things clearly are underway. And I think for some, a really big employee pain point with the pandemic has come a lot of caregiving challenges too, right? So I would add that to our list. If you have children at home and you're trying to work from home, or you're taking care of a loved one that is ill and they're in your home, those are also some challenges that we're facing. And then another that I would add to the list, the rising cost of medicine. For us, that if any of us need medicines, there's a lot going on in the pharmacy area as well. And that could also be an out-of-pocket pain point for an employee depending on their health or lack of health. All right, next slide, please. Lack of accommodation for physical and mental diversity. Yes, that's really, really good. All right, so carrying on with the conversation about what employees want at work. Matt, if you would go to the next slide, that would be super. Thank you so much. So in a recent survey that I was looking at, what the employees listed as their top valued benefits, they basically itemized these as being the things that they want the most. So employees are valuing the following benefits. And the reason this is important is, what are the challenges? What do employees want? And what do employers have available in the benefit plan to meet the needs of the employees? So this is what came out in this particular study. Employees valuing the ability to stay in the remote workspace, looking at 4-day work weeks. I know some countries have attempted to do this. I don't know the outcomes of how that's going. Paid vacation time, 10 plus business days equals 2 weeks of paid vacation each year. Flex time at work. So one of the things that we've done with the pandemic and this Great Reset is valued having more time for self-care, I believe. The ability to get up from your desk at lunch and go for a walk, come back to your desk, those kinds of things. Run out to an appointment, come back, you still can get all your work done, right? We're not doing 4-day work weeks yet. No, we're not either. And an investment in the employee for professional development. So the ability to have advancement opportunity at work is also a top valued benefit for employees. And so employees are saying, we want to be able to learn more so we can do more. And those kinds of things, when a company invests that way, the employee is more likely to stay with that company with an investment in them. Usually there's a corollary investment back in the company. And that's great when we're talking about retention issues and the Great Resignation that continues to rage on. Next slide, please. So now, what are the employer pain points? What are they feeling right now? So if you would, what do you believe that employers and organizations are dealing with right now? What are their challenges? If you want to type a few in the chat box. Okay, so I'm going to guess the responses that are going to come in are very closely going to mirror the same as the employee. Many companies offer LinkedIn Learning as a benefit. Yes, very, very good. Good notation. There's so many great courses there. So employer pain points. Employers feel that they don't know what employees want. Okay, so that's a pain point. Unfortunately, several companies focus on more current daily tasks, completing daily tasks versus professional development. Yes. So finding the balance of those, right? So employers, just like employees, are struggling with engagement of a workforce working from home, balancing out work from home and return to work. What is appropriate? What's going to work? In the return to work, bringing employees back to work who don't want to be there. No, I want to stay at home. That's an employer pain point, right? So they start to mirror one another. Attrition of highly skilled people. Yes, we have a retention problem right now, right? And with the great resignation and retention and attracting new talent, we have a myriad of employer pain points in that space, right? So not only are employers faced with keeping people, the great churn and burn is continuing. There's also the ability to go out and find replacement talent for those that are leaving. In the interim, an employer and employee pain point is that who's picking up the slack? So if 4 employees leave a team in 1 week or 2 weeks or whatever the time frame, where does all that work go, right? So then the work is spread amongst already burned out employees. They're more exhausted, it's more stress, and it's this really deep dive cyclical thing that's going on right now where we're just going deeper and deeper and deeper with the churn and burn. So I see some really good additions here. Employer pain points, struggling with learning and development. Yes, so good. Lack of formal coaching for efficiency and professional development. Yes, and a lot of it has to do with Farah's comment. We're so focused on the daily tasks that we're not carving out time for return to work education and adaptation and coaching along with the professional development, right? We don't have time for that, right? Who's heard that before? So these kinds of things are critical. So you see that the list between employee pain points and employer are very similar, right? So at the root of it, there's some things that we can talk about keeping employees well at work, happy at work, committed at work, feeling well, all those things, how we do that. And so there's a lot of challenges ahead of us in adapting to this new day and age that we're all living and working in. All right, next slide, please. So when we talk about what employers want to keep their employees happy, right? They want to make sure that they've got benefits in place that are competitive with the local market, that are valued by the workforce that they're serving, right? So offering benefits that the employees aren't interested in is not going to be an efficient strategy for keeping employees happy and at work, right? And so a lot of the benefits that we had post-pandemic, a standard package of benefits, vision, dental, FMLA, the things, that has changed phenomenally because the pain points have changed, both for employees and employers. So Emron here is saying some employers are losing great employees due to the lack of certain HR benefits, such as infertility treatment. Yes. Carrot Fertility is gaining great credibility. Bariatric procedures, yes. Hinge Health is leading in the pack for musculoskeletal injuries, that's a huge rising cost in the workforce, right? Musculoskeletal due to tech neck, sitting, back pain, all of those things. So great observations. And so employers, they want employees to be happy, healthy at work. They don't necessarily know how to do that, right? And how do you improve well-being at work? They might be able to look at benefit package and go, well, that's not really what our employees need right now, but what is it that they need? So there's a lot of intermediary steps in there that need to have happen. They want employees to be happy at work, right? And I would say every CEO wants employees to be productive. So with that being said, which data sets do we use, things we can consider, potential data sets that we can use to measure employee and employer well-being? We have surveys for employee engagement as well, and you can tie that in and overlay that as another set of data, right? How we're measuring productivity, yes. So in the space of tying the dots together, which data sets we're going to use to measure both employee and employer well-being, we can look at some of the following. And this is just a beginning list, right? You certainly can customize this to meet the needs of your organization. The data sets that I always leaned into, and yes, you can have participation metrics. 30% of the workforce was involved in workplace well-being. You can start there. But over time, you need more concrete data relative to the economics of the work, so we can talk about the value proposition of an employee well-being program. And if you haven't one, you use that conversation to leverage and convince a CEO or CFO that they should have one. So you have to talk their language. We talked about this in part one. So you can look at the total cost of care per annum. Effectively, can you bend and or hold steady, maintain a cost curve around the total healthcare spend for a company? Right? And that may not be a short-term solution. That may not be something that you can effectively tackle in year one. It might take you a couple of years of an employee well-being program to effectively say, yes, we have mitigated spend, we've held it steady, we're starting to bend the cost curve. That's a really big mountain to climb, but these are very powerful statistics. Dollars talk. So if you can get your arms around these stats, you can have some amazing conversation around affecting change in the workforce, leading with the overarching conversation of a well-being program, right? Because you have measurable outcomes. So the total cost of care per annum, per member per year, is a blend of the total medical spend and total pharmacy spend. Right? So you want to be looking and encouraging your leaders, your HR director, your operations leaders, your COOs, your CNOs, your CFOs, CEOs, all of the above, right down to the director level. So well-being can be part of a team conversation, becomes part of the culture, right? From top to bottom, bottom to top. Talk about spend. Okay, super, super important. And if you're looking at claims data, you can start to see trends month over month. So if you see a particular prescription coming up over and over as the top spend, you have a pretty good idea of what the top health issues are, right? So doing those kinds of analytics is very powerful, right? Number 2, the total number of doctor's visits per year. Right? So you might look at how many doctor's visits. So if you see initially at the start of a well-being program for a company, because you're messaging well-being and the importance of self-care, getting your annual visit, being connected to a primary care doc through the ages and stages of life, presenting the healthcare model where we embrace that managing of our health in partnership with our PCP or PA or whomever you're seeing. Ideally, we want to start to reduce the number of unnecessary visits, but at the beginning of a well-being journey for a company, because you start talking about it, you might see the initial at year 1 doctor's visits go up, because you might have employees who haven't gone in many years and go, oh, I didn't know I should keep up with my annual visit, and it's part of prevention, and maybe I could find something before it happens. And so initially at year 1 of a wellness journey for a company, the doctor's visits may go up, but you'll start to see that bend and start to go the other way, right? So in the prevention space, it is bending the cost curve. It might take a year or 2 to see that happen. Then we also want to track the total number of emergency visits, and maybe we put a clause there, unnecessary, but cost of these visits. So some of that comes around education in the workforce, healthcare literacy, and teaching our employees how best to utilize healthcare. So for the sneezies and the flu and the headaches and a tummy ache, are we going to an emergency department for care, or are we going to urgent care? Are we having a telehealth visit? What are we doing, right? So unnecessary usage of emergency department is really critical. And that comes through education and teaching our employees what that looks like. If they don't know any different, they don't know any different, but it costs the health plan significant amounts of money to inappropriately use an ED department, right? So we don't want people going to emergency unnecessarily. The cost of that is exorbitant. And we also don't want unmanaged employees or ill-managed employees or non-compliant employees who refuse to take their diabetes medicines in emergency over and over 2 or 3 times a month because they don't take their medicines, and they become the frequent flyers of the emergency departments, which have huge costs as well, right? So with the well-being program, part of what we should be working on is training and development and education around how to resource and source healthcare access. And we never should assume that employees know where to go based on their condition. They don't necessarily know that, right? So looking at claims data is so powerful, and looking at total cost of care, pharmacy spend, these kinds of things. It's not, it's the data. It has numbers attached. You got the data, you've got power to have some very strong conversation with your C-suite leaders to either keep your program going, to institute a well-being program, so forth and so on, right? Total number of sick days too. This is one that we did measure. And all of these are the metrics I used to live by in North Carolina when I was running a $500,000 business of corporate wellness for the hospital. We did track number of sick days, and we didn't do it at year 1 of our journey. We waited until year 2, 3, 4, and 5 for the companies that had hired us out. And we did start to see a reducing trend of the number of sick days. And so that was a beautiful thing to track as well. I will share with you, I also learned by doing that kind of work, though, some payroll systems don't track sick days. They just track PTO. So you might encounter that as well. But if you can, that's a really great statistic as well. And one of the ones that's coming, I think, more top of mind right now is the use of FMLA. A lot of folks have, and I think we're going to see more of this with the rising incidence of burnout and all the things that come with burnout. I really do believe we'll see more FMLA time. And this is where we need to be talking about these things, providing education, training, development, burnout training, return to work training, all of it, because folks just don't know, I think sometimes, that they're not well, and having conversation about that. It's like having a heart attack in my mind. You keep going, you incrementally adjust your shortness of breath with, I'm fine, I'm a little bit out of breath. The person living and breathing in that space, they've accommodated. And then they have the massive heart attack. And they're like, oh, I didn't feel that bad. Yeah, but you've been not feeling that great for a couple of years now. You just didn't recognize the symptoms. It's kind of the same with burnout, right? We have got to talk more about this. Next slide, please. And always, you can use employee engagement and employee satisfaction surveys and overlay all of that data as well, especially right now with the Great Resignation looming. All right, so some of the strategies that have worked, and this is from firsthand experience, both for the employer and the employee, having conversations with C-suite members. My experience has proven to me that when you have a CEO that's committed to their health and wellness, both at an individual level for themselves, being healthy, fit, the impact of that disposition highly resonates with them caring that their employees, their workforce are also healthy and well, and by virtue of that, committing a budget and leadership to oversee a work site well-being program. So I've also had the experience where I've had C-suite members and a CEO that never believed in it, and it doesn't go anywhere. So, having more conversations with our C-suite members around the value proposition, the potential cost savings, cost avoidance. These are the conversations we should be having with our C-suite members. Lead by example. This is for everyone. This is for every single individual on this call, every employee in every job, and every leader. You have to model the behaviors. Leading by example is critical. If you have your PTO, take it. You're not online while you're on your PTO. You're not sending emails to your workforce on Sunday afternoons. You're offline. You practice what you preach. And I see a lot of employers coming up super short on this, right? Leading by example. The culture of well-being starts at the time of recruiting. It needs to be part of the recruitment phase. And you can recruit top talent when you have things to offer, benefits like an on-site gym, great benefits in the well-being space. Do you cover the cost of massage? When I used to work in Canada, that was covered, right? It was fabulous benefit. I didn't encounter that so much working in America on company payrolls. So leading by example, starting at recruiting, that's where the conversations begin. If we hire you at this company, here's how we practice well-being. And you set the healthy boundaries, right? So we keep the employees on the rails, not going off the rails with burnout and sickness and disease and all the things that we can have an active role in. And it should continue on as part of the onboarding. There should be committed training and development in the well-being space. And that's inclusive of burnout now. You've got to provide education for employees to be able to step back and go, 5 signs of burnout. 5 signs and symptoms. Maybe I'm close, I'm not sure. Just to foster thought and awareness, right? I do believe that well-being should be baked into performance appraisals. The hospital system that I worked with in North Carolina did have a scorecard, a board-approved scorecard, and it was the hospital system scorecard, the C-suite scorecard, which then filtered down to all of us directors having goals that rolled up. Our scorecard rolled up to the corporate scorecard. We had well-being goals. We never quite got to the place of having it in our performance appraisals, but we talked a lot about it to the point that several directors did have a goal around the well-being of their teams. So we were starting to move the needle right before I changed roles and went to South Florida. And then standing meetings, you have got to practice what you preach. I believe I'm cracking myself up here, standing meetings. Yes, we should have meetings, not sitting, but standing, that too. In our regular weekly meetings, having every agenda for every team meeting, there's an agenda item called well-being, and you're talking about something in the well-being space. It has to be part of what we're doing. Next slide, please. Additional strategies that we can look at. Creating an employee resource group. Sumana just hit me super quick. Hearing employees' voices, which lead to employees' choices, which lead to benefit plan design and the necessary changes, and completing an audit of current benefits and updating as needed. So we've had some conversation there. So good. We're wrapping up here. Engaging providers and vendors and subject matter experts. I don't believe anybody expects a CEO to know everything well-being and all the C-suite's necessary lead. No, you need to bring in the subject matter experts, right? And then creating a healthcare literacy group. It could be a subgroup of an employee resource group and or a subgroup of an employee wellness committee, right? But that is key right now because we're facing so many health challenges. All right, so to wrap it up, I just want to show you 2 case studies super quick. Next slide, please. All right, case study 1. The company was 1,200 employees, and my strategy was to add wellness coaching. I had a wellness coordinator, boots on ground, who oversaw the entire wellness program with me at the helm. I formed the wellness committee. I led it for the first year to make sure the infrastructure was in place. Everyone kind of knew how it was supposed to go. At year 2, we turned over the leadership of the wellness committee to one of the employees of this company. And I attended, and I was a silent support system. So what we did every year was we reviewed the annual Blue Cross Blue Shield report, right? And I did that with the CEO of the company, the CFO, the HR director. I was the wellness expert and the person that owned the contract. And so I was in these corporate meetings with this client. And we would look at the capture rate of telephonic coaching for chronic conditions. So this company paid Blue Cross Blue Shield for telephonic coaching for chronic conditions. And after a couple of years of looking at this report and seeing 12, 13% engagement, how many people actually picked up the phone to talk to a health coach about their diabetes was horribly dissatisfying and totally unsatisfactory for what they were paying. And I won't share that. But let me just tell you the total cost per year for this company to pay Blue Cross Blue Shield for telephonic coaching with little to no outcomes was $85,000. So I said to my client, how about you give me that $85,000 and I'll add a wellness coach to our team. So we'll have a wellness coordinator and a wellness coach. I want the wellness coach to be an RN. And we'll take care of the coaching on chronic diseases back and forth between the coordinator. Good? And that's all I did, folks, was a renegotiation of spend. And I promised, I put my career on the line and I said, I promise you, if you will give me the chance to do this for 1 year, I will save you $85,000. And I used my metrics to do it, which we talked about 5 slides back. We saved way more than that. All right. So that was strategy 1, super successful. Slide 2, please. The second case study was also around wellness coaching. And I'm so glad to see wellness coaching getting huge attention in our industry right now. So the second case study was Company B, was another company that I was responsible for creating the employee well-being program and managing the outcomes. The strategy was to add wellness coaching. And basically what we did was we did this quarterly, but looking at the cost of care for the top medical claims costs. Our health plan did cover diabetes and hypertension, 2 of our top cost drivers, right? We had a diabetes center, but few employees went there. So we were just talking about, well, how are we going to manage our diabetics and hypertensives? And our wellness coordinator was doing group activities, walking programs, weight loss programs, group. And I proposed to my CEO and COO, we need individual coaching. If they get engaged in their health in our walking program, I need a health coach to work with them one-on-one to then effectively manage their hypertension, because now they're really interested in their health. And so again, I put my name on the line. I said, if you will give me the opportunity to build a wellness coaching program for this client, I will save you that money. And that's what we did. We added a wellness coach. And at the first year, it was a physician, a misplaced physician, because we were making a change in the system. So this doc was about to lose their job. And I'm like, let me have that physician. And we coached plan members. So it could be spouses as well, as long as they were on our plan. Hypertension and diabetes, the 2 disease states that were on the health plan. So they could go to our diabetes center or go to my medical wellness coach for coaching. They could choose. And it was optional. We didn't require them. We had 120 plan members engage, and we looked at the costs of those plan members year prior versus the 6 months that they were in coaching, and we had saved $300,000. All right, so you can do this too. So coaching effectively, going from a group model to an individual, targeting disease states with one-on-one coaching, magic, just magic. All right, so with that, I'm going to hand it back to Hannah. Say thank you so much for the opportunity to share. I can share a copy of a scorecard. I would have to do that by email if that's okay. But Hannah, let me toss it back to you.
Thank you so much, Debbie. Wow, finally, case studies that we can actually look at. You have actual metrics and you showed us how to do it. I love having speakers come in and actually give us tangible next steps on what we can actually do to move forward. So kudos to you. A huge thank you to Farah, Imran, Sumana, Mark, Debbie for all of their effort today and for all of the comments. The cost savings that you just demonstrated is huge and it's totally game changing. So thank you so much. Just a couple housekeeping items. If you want to follow Debbie, we'll place her information here. Please visit her on her YouTube, LinkedIn. Her website's awesome. She looks like a badass with her. She's totally fit. Absolutely love her. And then those of you who are kind of connecting and commenting in the chat, please friend each other, right? This is great information. This is great way to network and collaborate. You guys are spending your time on in the morning and afternoon. And so we want to be able to use this time to get to know each other. And who knows, one of you guys may be a collaborator, a moderator, a speaker in the future. If you're interested in reaching out to us, please join us. Email us at the www.workplacewellnessclub@gmail.com. We have rebranded to the workplacewellnesscollective.com. So visit us, like us on YouTube, like us on LinkedIn. And I just appreciate you guys so much for spending your time with us. Enjoy your Wednesday from wherever you are. I had a wonderful time as your moderator today. Hope you guys have a rest of your day. And I look forward to seeing you guys next time.
Thank you.